Let's try to quickly revise the slide of large-sized artery. How do we say that this is large-sized artery and what are the identification points? We can see three distinct layers: tunica intima, tunica media and tunica adventitia. Tunica media appears to be the thickest of all the three layers and it is made up of plenty of smooth muscles and elastic lamellae. Then you can briefly describe tunica intima is made up of a lining epithelium formed by endothelium, subendothelial connective tissue and an inconspicuous internal elastic lamina. Tunica adventitia is thin and contains nervi vasorum and vasa vasorum. These are the identification points. But how do you differentiate this from the slide of muscular artery? Remember, the entire wall of the muscular artery will be thin, so the space that it occupies in 10x magnification is much more smaller, and the tunica media and tunica adventitia sometimes appears to be of same thickness, even though the tunica media is almost twice as the size of tunica adventitia and you have a very prominent internal elastic lamina. This is how we should identify these two slides. But remember, if you get these slides for discussion, you can always take a look around the entire slide and see the size of the artery. Never try and look when you are focusing the spotter examination. You will get into trouble, okay? Only when you have the slide for discussion, maybe hold it in your hand and compare the size so that you will identify which is small sized artery or medium sized artery and a large sized artery.